Hello, it's a pleasure to be here today. I am Ann Kelsey Lamb, the Director of Regional Asthma Management and Prevention, also known as RAMP. I'm here today with my colleague, Joel Irvis, RAMP Associate Director, as well as our partner, Al-Ali Baños-Keener from the EPA Region 9. Today, our presentation will focus on asthma home visiting as an evidence-based intervention that improves health outcomes, reduces healthcare costs, and reduces asthma disparities. Next slide, please. By the end of this session, participants will have learned the basics of asthma and asthma disparities. They will understand the role asthma home visiting programs can play in addressing asthma triggers. They will have learned about Medi-Cal financing to support asthma home visiting services, and they will be able to identify how asthma home visiting aligns with the focus on environmental health and can be integrated into GAP grants. This list also reflects the order of our content, which may be useful for you to know if you want to skip any sections. For example, if you already know a lot about asthma and asthma home visiting programs, you may want to skip ahead to learn about integrating asthma home visiting into your GAP grants. Next slide, please. I'd like to start with a bit of information about who we are. RAMP is a project of the Public Health Institute based in Oakland, California. Most of our work focuses on the state of California, but we are involved in several national projects in partnership with the EPA, including providing technical assistance to other states and communities. Our mission is to reduce the burden of asthma with a focus on health equity. We don't provide direct service to people with asthma, but we support those who do. We build capacity of asthma stakeholders by creating and disseminating tools, providing strategic guidance, and conducting training and technical assistance. We create linkages among partners for peer learning, collaboration, and network building. And we mobilize our networks to advance policy and systems change. Next slide, please. I'd like to start by covering the basics of asthma and asthma disparities. Asthma is a chronic inflammatory disorder of the airways, characterized by inflammation of the lining of the airways, tightening of the bands of smooth muscles surrounding the airways, and excess mucus that further narrows the airways. Next slide, please. Asthma is a significant public health issue. In California, about 1 in 7 people has been diagnosed with asthma. Each year, asthma causes unnecessary emergency department visits and hospitalizations, missed work and school days, and in the worst cases, death. While these data are for California, we know that each state has similar statistics related to asthma. Next slide, please. We are particularly concerned about asthma disparities based on income, race, and ethnicity. These disparities are certainly relevant to tribal communities. As just one compelling example, according to the U.S. Department of Health and Human Services, American Indian, Alaska Native children are almost twice as likely to have asthma as non-Hispanic white children. In California, American Indians and Alaska Natives have 1.4 times higher rates for emergency department visits due to asthma. And asthma disparities are not happenstance. They result from historic and current policies and systems that create environmental and social inequities related to air quality, land use, transportation, housing, access to care, education, and the experience of racism and poverty. Next slide, please. Our focus on asthma disparities and the social and environmental inequities that drive them also drive our overall goals. We currently have 3. One is healthy air for all, another is healthy and stable housing, and the third is healthcare equity. While all of these are relevant to tribal communities, today we're going to talk about asthma home visiting services, an evidence-based intervention that combines our focus on healthy and stable housing with healthcare equity. Next slide, please. So here's what asthma home visiting services look like. Over a series of visits, a community health worker, promotora or other professional meets with the family in their home to provide culturally relevant asthma education. The education covers basic asthma facts, the use of medications, self-management techniques, and self-monitoring skills. After building trust and rapport, they work with the family to conduct an environmental asthma trigger assessment. Next slide, please. During the assessment, the home visitor will look for signs of common environmental asthma triggers, like mold and moisture, or pests, like cockroaches. They'll work with the family to understand whether there's exposure to things like environmental tobacco smoke, chemical irritants from cleaning products, or nitrogen dioxide from gas stoves or space heaters. This is also an opportunity for the home visitor to educate the client about the connections between those triggers and asthma. Next slide, please. Here are two photos of what these triggers look like in the home. The first is cockroaches and the second is mold. Next slide. It's important to note that low-income people and people of color are more likely to face substandard housing conditions. Housing is closely linked to health. Substandard housing conditions expose tenants to factors that negatively impact their health. With asthma, there are things within the control of the residents. They can prohibit smoking in the home, use asthma-friendlier cleaning products, or use dust mite covers on the mattresses and pillows. But there are other factors that are outside the control of renters and result from substandard housing conditions. The mold and pest infestation we saw in the photos are just two examples. So this graph shows that low-income people and people of color are more likely to face substandard housing conditions. This is at least partly due to years of disinvestment and other policy decisions that can lead to substandard housing. This disparity makes it all the more important to provide asthma home visiting services to the people who need them most. Next slide, please. So back to the home visit. After the assessment, many asthma home visiting programs provide supplies or services to help remediate the asthma triggers that they identified. The remediation is essential for improving asthma management. Even someone with the best clinical care who is following their medication regimen perfectly will continue to have asthma exacerbations if they're regularly exposed to asthma triggers in their homes. Giving a family a HEPA air purifier to help reduce exposure to wildfire smoke, or providing pest management services to eliminate cockroach allergens, or helping a family find ways to reduce moisture and get rid of mold. These types of supplies and services truly make a difference in the lives of people with asthma. Next slide, please. And we know that these services work. Asthma home visiting is an evidence-based intervention that has been proven in study after study to improve asthma outcomes, reduce healthcare costs, and reduce disparities. Studies have shown that asthma home visiting services reduce emergency department visits and hospitalizations, improve asthma control, decrease symptom frequency, decrease work and school absenteeism, and improve overall quality of life. Next slide, please. So what makes them work so well? One reason has very much to do with who the asthma home visitors are. Research has shown that interventions provided by community health workers and promotoras are particularly impactful for communities that have been historically underserved. Home visitors typically speak the language of the clients and have deep cultural humility and an ability to engage with diverse stakeholders. Home visitors can be the bridge between their communities and the healthcare system. One colleague called them agents of change, who are well trusted in the community and can meet participants where they are at, intentionally building rapport, trust, comfort, and connection. Home visitors also excel at using participant-centered service delivery models, including culturally responsive curriculum. These approaches are tailored to participants' unique needs and preferences. This can include bilingual staff, flexibility with scheduling, and shifting educational approaches to meet the needs of children or adults. Using these approaches, participants are more engaged and more likely to comply with home visitor suggestions, which leads to better outcomes. Next slide. So given that asthma home visiting interventions are so effective, it stands to reason that everyone with poorly controlled asthma should have access to them. Unfortunately, that's not the case. Many asthma home visiting programs have relied on grants, which sadly come and go. One way to ensure access to those that need them most is through Medicaid coverage, given the disparities based on income. This is a map created by the American Lung Association showing which state Medicaid programs cover asthma home visits. While several states in this region are blue, meaning they have at least some coverage, only one state in the country, Connecticut, provides coverage without any barriers. So what can be done about this? There are a lot of different approaches, but my colleague, Joel Irvis, is going to tell you about the path we've taken in California. Thank you.
Thanks, Anne. Here in California, we've been working with a broad network of partners to expand access to asthma home visiting services for low-income Californians with poorly controlled asthma. We have been targeting policies at the Department of Healthcare Services, the state agency that runs California's Medicaid program called Medi-Cal. In this photo, California State Senator Melissa Hurtado on the far right is introducing a bill that aimed to do just that. That photo is but one moment in what has been a long and winding advocacy road. Our state effort began in 2015 after the adoption of a federal policy rule called the Preventive Services Rule. This rule allows state Medicaid agencies to provide reimbursement to non-licensed professionals for certain preventive services. We decided asthma home visiting services provided by CHWs, promotoras, and others would fit perfectly with this rule. That federal rule led us to years of state advocacy that included direct engagement with the state Medicaid agency, 2 pieces of legislation, and working through the state's budget process. In 2019, we came close to our goal of Medi-Cal coverage, but instead the governor and California legislature decided to allocate $15 million to support asthma home visiting services. Of course, $15 million in support of these services was a win in and of itself. So for the past 2 years, we've been helping with the implementation of those funds. It's being run as a grant program through the Sierra Health Foundation and has helped provide much needed services to many Californians with poorly controlled asthma. While this particular funding opportunity is now closed, the funding has also helped build the capacity of diverse organizations to provide these services. I want to stress that many of the organizations funded by this opportunity are new to asthma or were new to asthma. They had great community connections, strong skills at connecting with diverse populations, and other assets. I mention that so you don't worry if you or your organization doesn't have a lot of asthma experience. You can learn this. So as wonderful as these funds have been, they're yet another grant program, and to sustain services, we really need policy change. Luckily, over the past several months, we are finally seeing success in this area through 2 complementary policies in California. One is the Asthma Preventive Services Benefit, and the other is the asthma remediation option under the Community Supports Program. I'll start with the Asthma Preventive Services Benefit. This new benefit covers asthma self-management education for any beneficiary with asthma, either in the clinic or in the home. Additionally, for people with poorly controlled asthma, the benefit also covers an in-home environmental trigger assessment in order to identify those factors that may continue to trigger a person's asthma, even when they use state-of-the-art medications. As for who can provide the services, a wide range of non-licensed professionals are covered, so long as they have met certain requirements, such as participating in a training informed by national asthma guidelines. We're thrilled about the benefit, but it's still missing a critical piece, which is addressing any triggers the environmental assessment may discover. That's where asthma remediation under the Community Supports Program comes in. So sometimes called in lieu of services, community supports are a substitute for traditional medical services to avoid the utilization of other costlier services, such as emergency department use. Typically, Medicaid doesn't cover non-medical services. That's not the case here. Community supports are covered by Medi-Cal funding, which is a huge win for addressing upstream factors that influence health. The way California structured its community supports program, there are 14 different services that a Medi-Cal managed care plan has the option of integrating into its program. Asthma remediation is one of the 14 options. The program covers minor to moderate remediation with a lifetime beneficiary cap of $7,500. The program is designed to support a range of supplies like mattress and pillow dust covers, HEPA filtered vacuums, dehumidifiers, and air cleaners. It can also include services like minor mold removal and remediation, ventilation improvements, and integrated pest management. The program is also flexible. Other supplies and services may also be covered if they're medically appropriate and cost-effective. While both policies are new and there are a lot of implementation details to be worked out, we're still really excited about the development. Fully implemented, these policies have the potential to expand access to asthma home visiting services for low-income Californians with poorly controlled asthma. Additionally, the policies can help improve the financial sustainability for asthma home visiting programs so that they're here not just now, but for years to come. Now, as much as I've celebrated the approach we've taken in California, it's really important to note that our path isn't the only path to sustaining asthma home visiting services. Several years ago, the EPA created this helpful infographic that shows the broad array of funding mechanisms that involve Medicaid, as well as other sources, from local health departments to community development block grants. So even if you're not in California, there may be other funding sources to take advantage of to support asthma home visits. We also hope that this work can be a model for others. For groups that are interested in pursuing this work, we want to note that there are numerous resources available to support you. For example, recently we released a new tool designed to help managed care plans and those of us who work with managed care plans to support asthma home visiting services. Another tool is an e-learning module produced by the National Center for Healthy Housing, which focuses on building sustainable systems for asthma home visits. RAMP and the National Center for Healthy Housing are partnering to provide technical assistance on establishing and sustaining asthma home visiting services. Additionally, as of this recording, RAMP is about to launch a new technical assistance project specifically to support interested Region 9 tribal communities along the border. This work will include building connections and providing tools and training for tribal communities to build capacity to build and sustain asthma home visiting services. Technical assistance is free and tailored to the needs and interests of the participant. So for more information, please don't hesitate to contact us. So to close out the presentation, I'm going to turn it over to Lee, my colleague at the EPA, who will talk through the connections between asthma home visits and GAP, the General Assistance Program.
Thank you, Joel, and thank you, Anne. So I am here to talk to you about how to develop indoor air programs that address asthma disparities. Next slide, please. So why develop a tribal indoor air program? Next slide. I think probably the main reason to develop a program is due to the extreme weather changes that we have been experiencing lately. This great graphic here that was produced by the Centers for Disease Control shows how health effects are affecting and are closely linked to these extreme weather events. Next slide, please.
Lily, are you seeing the next slide?
Yes, I'm just having a little bit of an issue with my talking points here. Okay, I'm sorry, I see them now. Apologies for that. Okay. Okay, so now I'm okay. So going on to the next slide. So this is fine, actually. So what happens inside of our homes impacts our indoor air quality. So this is usually very evident when we have wildfire events and you can see and smell the smoke inside your home. And depending on what's going outside, whether it's odor coming from a nearby factory, a wildfire, or heavy traffic fumes and dust from high commute hours, for example, the contaminants that are outside of your home are going to end up inside your home. It's important for communities to learn about their air quality and how it affects their indoor air so that we can decide when to spend time outdoors and when to open windows and doors to ventilate. Okay, next slide. So in addition to the outdoor air that impacts our indoor air, we have other sources of indoor air pollution as well. And in fact, studies have shown that indoor air pollutants can be 5 to 10 times and up to 100 times higher indoors than outdoors. So in addition to the environmental asthma triggers that Ram just mentioned, there's other indoor air pollutants that can concentrate indoors, like carbon monoxide, formaldehyde, and radon. And there's also, of course, cigarette smoke, marijuana and vape fumes, as well as viruses and indoor particulate matter, which we unknowingly create ourselves. Many indoor air pollutants can also be asthma triggers, as we previously mentioned. So identifying and minimizing these sources of indoor air pollution can improve your indoor environment and reduce exposure. And this is very important information for communities to be empowered to take action. Next slide, please. Poor indoor air quality affects us all, but especially the most vulnerable, like older adults, pregnant women, and especially children, because their bodies are still developing. People with pre-existing health conditions like heart and respiratory conditions, asthma and lung disease, as well as people with diabetes are more vulnerable to the effects of indoor air pollution. Next slide, please. So another reason why every tribal environmental health program should have indoor air as a component in your environmental programs is that we spend 80 to 90% of our time indoors. Poor indoor air quality can have immediate effects which show up shortly after exposure. This can include irritation of the eyes, nose, and throat, and headaches, dizziness, and fatigue. But we also know that indoor air pollution can have long-term effects that may show up either years after exposure has occurred or after long or repeated periods of exposure. And this can include some respiratory diseases, heart disease, and even cancer. Next slide, please. So the good news is that there are things we can do to improve our indoor air quality and limit our exposure to indoor air pollution, including minimizing environmental asthma triggers for asthma sufferers. So by taking control and recognizing the sources of pollution indoors and those asthma triggers, we can improve our indoor air quality. And recognizing them and knowing about them is key. And this is where tribal environmental programs can take the lead. Next slide, please. Okay, so now that I've convinced you to add an indoor air component to your upcoming GAP work plan, here are some steps you can take. Next slide. So the new GAP Technical Assistance Handbook was just released in September, and it's still very new. And I think we are all just beginning to familiarize ourselves with it. There will be some upcoming training sessions hosted by headquarters, EPA headquarters, to review the new Technical Assistance Handbook. But I went ahead and took a look, and I just copied and pasted here some of the areas that mention indoor air quality. So the handbook is meant to support the development of GAP work plans and to help you identify priorities and long-term development goals that you will include in your EPA tribal environmental plans. The activities in the handbook are no longer considered or called GAP indicators, but they are milestones. And they are meant to help the tribe achieve capacity indicators that you identify in your EPA tribal environmental plan. The focus of the program is still on building tribal staff capacity to be able to manage tribal staff environmental programs. So in order to do that, let's jump right in and talk about how to build capacity. Next slide. So here is some information that you can start reading about and learning about to build your capacity on healthy homes. Working on healthy homes will address a lot of the issues that are related to environmental asthma trigger identification, education, and outreach for the communities that you work with. And here's just some, there are many, many resources available, and I just added some here for you to consider looking into as you start thinking about developing your program. Next slide. Just another quick slide about healthy homes and the 8 principles of a healthy home here. Next slide, please. Also encourage you to build your capacity on asthma. Healthy homes, indoor air, and environmental asthma trigger education go hand in hand. It's extremely important to coordinate with health department staff, hospital staff, schools, rec centers, Head Start centers, childcare centers, senior centers, and talking to the community is also extremely important. These are some of the things to keep in mind as you're starting to develop your asthma programs. Next slide, please. And here are some asthma resources as well that you can look into as you start learning more about some of the information to include in your work plan. Next slide, please. Information on integrated pest management is also very closely linked to asthma and identifying environmental asthma triggers. There are some great resources here that I wanted to share with you all to look into as you're thinking about developing your indoor air and asthma programs. Next slide, please. Other things to consider as you're working on this, on planning this information and activities for your tribal work plan is to make sure that indoor air quality is part of your EPA tribal environmental plan. The ETEP, as we call it, the acronym, is required of every tribe that has a general assistance grant in place. So making sure that indoor air quality is in there is definitely something to include. And then reaching out for technical assistance to any of us here on this list. We work very closely with the Institute of Tribal Environmental Professionals, and Mansell Nelson is your contact on indoor air quality. You can always reach out to me. I'm the indoor air and asthma coordinator. And then you can also reach out to the National Tribal Air Association or the Tribal Healthy Homes Network. They do a lot of work on indoor air as well. Next slide. Okay. So let's talk now about developing a work plan that is part of your GAP grant. Next slide. So I wanted to share these great sample work plans that were developed by Region 10. There's a series of them, and I just copied the first page of each of the work plans to give you an idea of some of the examples that you can start thinking about adding to your work plan. One of the things to note, though, is that this is a Region 10 work plan. So a lot of the links that are included here are specific to Region 10. So if you're going to use this as a guide, just make sure that you modify these links, of course. Some of them will be relevant to Region 9, but make sure that you modify them so that you're including your Region 10 links and resources in your work plan. This one here is on healthy homes. And next slide. There's also a sample work plan on developing residential wood smoke reduction. A lot of tribal communities use wood stoves, and this is a source of indoor air pollution that is very important to eliminate, and definitely an asthma trigger as well. Next slide. There's also a sample work plan on road dust emissions, which is also something to consider in your air quality program. As we mentioned, outdoor air makes its way inside and mixes with whatever is happening indoors. So definitely addressing outdoor air quality is important, and especially making sure that community understands about outdoor air quality and how it impacts indoor air quality is important as well. Next slide. And then the next one is a sample work plan on preparing for wildfire episodes, emergency preparedness. So wanted to make sure that you're aware that these work plans are available for you to look at as guides as you develop your work plan for your GAP program. And there's a link here on the slide to access these work plans. Next slide, please. Okay. So in summary, the GAP program is an opportunity for you to learn and build your capacity. It's an opportunity for you to learn and train and investigate and actually get paid for it. You know, the GAP program is paying a salary for folks to do this work and to learn about the work, to be able to manage your own environmental programs. So it's important as you're doing this to identify any needed skills, especially now as we are, you know, in the age of COVID, and also with the extreme weather challenges that we've been seeing, increased heat events, increase in wildfires. So making sure that you're, you know, thinking ahead and identifying those needed skills. Meeting with the community is very important because you can find out what some of their needs are and how they are affecting the community. Always reach out to other tribes to learn from them. A lot of tribes are developing programs, and they can give you information and resources and share their experiences with you. Again, reaching out for technical support. We're always here to assist. EPA, as I mentioned, ITEP, NTAA, and others are always available to provide input. There's also a lot of work groups out there. NTAA has an indoor air work group that meets regularly to talk about indoor air quality. They also have a wood smoke work group that meets on a regular basis. Participating in those work groups is really important to develop information and knowledge about what to focus on. Again, I think one of the most important things is collaborating, as I mentioned before, with your local health departments. The Indian Health Service is often working on different projects that might be relevant to your work. HUD is always, a lot of tribes also have HUD funding, so coordinating those different sources of funding and the different areas that house our vulnerable communities, like our senior centers, after school programs, health, childcare centers. Making sure that you're coordinating with them is very important. And then last, just making sure that you have all the tools that you need to do your work, whether it's a webinar platform or a listserv, maybe actual physical tools like a moisture meter or a carbon dioxide monitor, for example. Maybe indoor air monitoring equipment or sensors is something to consider as well. Okay, next slide. So I quickly wanted to go over some tools and resources. Next slide. Additional tools and resources. So we just released the Tribal Indoor Air Quality Training and Resource Directory. It's brand new. It was released maybe a couple of months ago, and it's available on our website. The link is here. And it has a lot of great information on developing indoor air quality programs. A lot of great resources and information is there. Next slide. And probably all of the other resources that I'm about to cover are included in the Tribal Indoor Air Quality Training and Resource Directory, but I'm going to go over them quickly anyway. EPA's Indoor Air Quality webpage is being updated continuously, has a lot of great information on indoor air quality and things that you might consider adding to your tribal GAP program. We also have a quarterly newsletter that goes out, and you can subscribe to receive those updates. Next slide. We have a indoor air in tribal communities webpage as well that is updated with up-to-date information. Next slide. We also have IAQ in schools, very specific information if you want to focus and work with schools. This would probably also apply to childcare centers. There's a lot of great pre-recorded training available on this website, so I added the link here. all this training and information gathering can be added to your GAP work plans as capacity building activities. So definitely keep these in mind as resources. Next slide. And also wanted to share about our Safer Choice program, which is a program that uses less toxic cleaning products. And of course, this is closely tied to your indoor quality and making sure that you have fewer asthma triggers inside your home for folks with those sensitivities. Next slide. And just our website here with more information on integrated pest management. So if you'd like to focus on eliminating or minimizing pesticide use in tribal communities, make sure you check out this page and look into it and establish an IPM program at your in your community as well. And next slide. And then the last resource I wanted to share with you is the pediatric environmental health specialty units that work very closely with us in Region 9. They are a network of health professionals that focus on children's environmental health. They also provide training and resources to not just to parents and others who work on children's environmental health, but also to doctors. So they have a very interesting and useful PASU Learning Academy. Make sure you check it out if you'd like to learn more about specific environmental health issues there. And I think that was it for me. Just wanted to thank you for viewing this presentation, and I'm available to answer any questions. My information is here. Feel free to give me a call. Every year when you submit your GAP work plan, if there's an indoor air component in your GAP work plan, I take a look at it and I give you some comments and recommendations and I share resources. But of course, you can reach out to me in advance of submitting your GAP work plan if you just want to discuss and plan. So thank you so much. And that is the end of my presentation.